doing a lot of fun things to our patient all at the same time. So Sharon is doing Scarlet, which is microneedling and radio frequency to her legs. And this will help tighten above her knees and her entire thigh, which is fantastic. So it tightens and lifts. I am doing BBL Hero to her face, neck, and chest, which will help with her pigmentation, brown spots, red spots. It'll help actually change her DNA and make her skin healthier. So I'm going to show you a typical BBL Hero for the chest. Sorry, and she likes her pronouns, so we're just going to have her, you can keep doing that. Okay, so I'm going to start right over here. Here we go. There we go. Easy, easy. And this is just a really simple procedure that will help, like I said, get rid of brown spots, get rid of redness. It will make her skin healthier. And they've done a lot of studies on this treatment, but one of the studies that they did, they took people over 50, they treated them once a month for 3 months with the BBL. They biopsied the area they treated, they biopsied an untreated area, and they biopsied some college kids' skin. And they found that the molecular genetics of the skin cells after just 3 treatments were similar to the college-age kids. These people were over 50 and had done 3 BBLs. So that's pretty amazing. And I have my kids do BBLs because it helps make their skin healthier so they don't break out with acne. So really you can be any age and do BBL. The other study that I like about BBL is they took providers and they said, how old do you think these people look over here on the left? And the provider said, well, I don't know, they look like they're 45, 46 years old. Good job, you can tell how old people are. So how old do you think these people look on the right? They said, well, they look 45, 46 years old over there too. Well, these people were over 55 years old, but they had been doing routine BBLs. There's no bad reason, there's no reason to not do BBL. Everybody should do BBL. And I also always say that if you have healthier skin to start with, it'll make everything look better. So if you do Botox or fillers or those types of things, if you have healthier, thicker skin, your filler is going to look better. Your Botox is going to keep longer. So there is no reason to not treat your entire skin, the largest organ of your body. And it is the first thing that people see is your face. So that is another great reason to start taking care of it or continue to take care of it. And typically BBLs, you do it once a month for 5 months and then 4 times a year for maintenance. Now, as for what Sharon's doing, she's doing Scarlet. So that's microneedling with radio frequency. So it will help tighten and lift. So as the little baby needles come down, they are going to make a channel into her skin. And then as the needles get to their depth, they're going to poke at the fibroblasts to make collagen. Now at the same time, when they get to their depth, they are going to release radio frequency. So that's going to irritate those cells to make collagen. And then as the needles come up, the radio frequency will follow it, and it will tighten every single layer of your skin. So that's why it's different than Morpheus or these other microneedling radio frequency devices, because nobody else, none of those other devices have what's called the Na effect, N-A, and that's the tightening that happens in every layer. So it's a benefit, huge benefit to Scarlet. Also, Scarlet has got tapered needles, so they go in very smoothly. It's not like you're jabbing those needles in, they slide in. So it's a very comfortable procedure, and you can do it anywhere you have skin, which is everywhere. So it can tighten and lift everywhere. So anyhow, there's 0 downtime from either of these procedures, which is great. I would tell our patient, turn your head the other way. I would tell our patient, don't go in the sun tomorrow because of BBL or over the next week. And she'd want to apply sunscreen, etc. For the next week to 2 weeks. Well, every day she wants to apply sunscreen, but anyhow. But Scarlet, it doesn't matter if she goes in the sun. So these are easily accomplished during the summers, especially when we're in the Pacific Northwest, unless you're going on a vacation to Hawaii or somewhere that you're going to be sitting in the sun for 5 hours straight. There's not really any contraindications to these, so they're both really generalizable to most patients. And so if you want to find out if either of these procedures are right for you, find us at RejuvenationMDMedspa.com.